Hi, this is Twila Brase, Citizens Council for Health Freedom here in Washington, D.C., and I have Dr. Kim Corba, a physician with the Direct Primary Care Clinic here, and she's just going to talk to you about why she has a Direct Primary Care Clinic and what she loves about being a physician in this new venue.
Hi, everybody. I love practicing without the intrusion of the insurance companies, having that time to spend with the patient and establish that very special relationship with them without having to worry about requirements of the insurance companies or the government. It's extremely liberating to feel that way and to be practicing the way it used to be 20 or 30 years ago.
Well, give me some sense, Dr. Corba, as to what your patients say. What do they see that they like about your kind of practice?
They love having the access and being able to get in the same day. They love having the time and not feeling rushed out of the office. I get that feedback most of all, that they don't want to feel rushed out of their appointments, and they don't feel that way anymore in my office.
And when you decided to start a direct primary care practice, what was the reason why you did that, and what can you tell the listeners were some of the struggles and were some of the joys in transitioning out of the practice that you had?
The major reason I decided to transition my full practice to direct primary care, which was a big leap of faith and it was scary. It was a very scary thing. I did it because I really just did not want to deal with the insurance companies and the government and all of their crazy requirements and restrictions. It was not allowing me to practice medicine the way I felt that I should be taking care of my patients. So the easy part was making the decision. The hard part was telling the patients, but they made that easier for me because they all understood why I was doing it, and they were all very supportive. The people who sign up for my office really see the value in what we're doing and are extremely happy, and I don't hear anybody regretting the decision to join the practice, and the word of it's spreading. The difficult part was actually extracting my brain from the insurance and the government model, and I found myself checking my notes and actually making sure I was meeting all of the requirements when I didn't have to do that anymore. It took me about 6 months to stop doing that. Yeah, it was like a form of PTSD, but that was a hard part that really nobody's talked about. It was hard saying goodbye to the patients that didn't want to stay.
And how many patients didn't want to stay? What's the difference in your clientele now versus your clientele then, or the numbers?
Well, I had exactly 10% stay with me, which is a national average. So I had several hundred leave.
Okay.
And that was difficult. But that just speaks for the system, that although they love the model and they were very supportive, that extra $50 a month was still too much for them to join a model that they knew that they would love, to stay with me as their physician after having me as their physician for years, because they're so beat up by the cost of healthcare that even that extra $50 a month for better care and better access was too much.
And when you when patients call you and they call you on the phone and they say, can we come in? What does your staff tell them, or what do you tell them about what kind of practice it is and what kind of services you offer?
You mean when they're inquiring to sign up?
Yeah, when they're inquiring.
I ask them, I speak to them usually. It's me doing the speaking, and I ask them to go on the website and educate themselves about the model and about my practice, and then we set up a meet and greet, and I actually have them come in and we do a face-to-face so they can see the office. But I like them to educate themselves by going on the website because it's very thorough and answers a lot of questions. And that way, when we have our time in the office for the meet and greet, we can really concentrate on more specific questions for them.
Is there staff? Is there any additional staff, or is it just you?
Oh no, I have a medical assistant and another part-time office type person to help. But it's me as a physician, it's just me. Although I have a physician and a nurse practitioner who cover me when I'm not there.
Okay. Mm-hmm. And then let me see, I had one more question that I was thinking of, which is how do people get to find out about you? What are the ways that you advertise, or how do they come? How do they know about you?
Well, I've actually backed off on the advertising. I hit it really hard the first year and spent a ton of money because I'm the first one in the area, 60-mile radius of my part of Pennsylvania. But I really backed off of it this year because I think the word's out and people know how to Google it. I'm getting a lot of reports that people are Googling direct primary care. There's also been a lot in the media about it recently, a lot in the medical journals. I think people are talking Word of mouth is always the best way. I have patients telling friends and family how happy they are with the practice. I mean, I'm almost at full capacity. I'm probably 15 to 20 patients away from closing my panel right now, and that's because of word of mouth. And I think there's just more of a national presence now. I know the Wedge is a great connection tool, and actually one of the docs I know just said they got a referral through the Wedge. And yeah, I know as physician, I've told my patients about it because they've asked about relatives in other parts of the country. So the Wedge has come up quite a few times. I know FMMA, some other places, list direct primary care docs.
Okay, well, thank you so much, everyone, for listening, and thank you, Dr. Corba. It was great.
Thank you. Thanks, Twila. It's always great with you.